healthy. Today, I have something near and dear to my heart that I'd like to share with you. I have Chuck Hinshaw from Virginia Vision Therapy Center, and you guys have offices all over Northern Virginia, Winchester, Springfield, Fredericksburg, and Manassas. And we're going to share something with you that I feel is going to change your life. If you are a parent that is struggling with your homework every day with your child, if your child is having such a hard time reading and you're getting reports from school that they are misbehaving, not able to focus and sit still, then this episode is for you. Stay tuned. And now we are going to get a glimpse into what a vision therapy appointment looks like. So take it away.
All right, so a couple of things real quick is to remind everybody that always seek your professional, your pediatrician, your developmental optometrist. These aren't things that I would suggest anybody trying at home, unless of course the developmental optometrist that you see suggests that you do any of these things. But this is just a glimpse into some of the things that we encourage in vision therapy. So the first thing we're going to talk about is the 3 B's, right? Balance, breathing, and background, all right? So Jaden, if you could, let's do the 3 B's. You ready? So got our feet flat. Okay. Do you feel pressure on your toes or your heels right now?
Both.
Both. Good. You're balanced. How's your breathing?
Good.
Good. Now look straight ahead. Can you see what my fingers are doing?
Wiggling, wiggling.
Yeah.
Wiggling.
What about now?
Waves.
Waves. Right. Very good. All right. So if you see what I saw, where there was a need to look rather than use the peripheral vision, that just tells me, visually speaking, that there might be some issues of integrating the peripheral vision and the central vision, right? But most importantly, what we're talking about is balance and posture. Posture will reinforce your visual state, and that visual state will then reinforce your posture, embedding. So if it's a less than optimal posture, you might have somebody who stands like this all the time, and this looks like your typical teenager. But what it may indicate is that there's a left visual dominance here, putting the left eye superior, right? So, but it doesn't always mean that. Sometimes that's just posture.
Sometimes it's just those bratty teenagers.
It's just, yeah, sometimes it's kids being kids. But we look at posture as another sign or symptom of a visual issue, right? So come on over here, buddy.
We have more stuff to do, movie
We've got
star.
a lot more stuff to do. Can I try something with you? Mm-hmm. Okay, so what I'm going to do first is I'm going to put these ankle weights on you. Can we do that?
Now let's tell everybody that that's only like 1 pound. We're not making him like lift weights. He's not going to become like
These
Arnold
are
in the legs
really
here.
light. They're 1 pound each. And what these will do is complete part of the puzzle for anybody who's trying to utilize their vision. Vision is a whole body experience.
That blows my mind. I mean, really, there's been so many light bulb moments today, and just, wow. I hope you guys are taking notes.
So vision requires that the individual is able to determine where they're at in gravity. That's the first piece of that puzzle. Where am I? And what we're doing for Jaden here by applying these ankle weights is allowing him to feel his body maybe a little bit more than he would otherwise. So usually it takes a couple minutes, and generally things will kind of settle in. So Jaden, come on over here. Let's do our 3 B's again. You ready?
Yeah.
All right, so we got our feet flat and balanced. How's the breathing?
Good.
Good. Now I want you to look straight ahead. Okay? Now you got it? Now bring your feet apart just a little bit for me. There you go. All the way like that. There you go. Now stand still, look straight ahead. Do you feel balanced? Got your breathing? Now, can you see what my fingers are doing? Can you see what my fingers are doing?
Yes.
Good.
Upside down.
Yeah. Now, look
Upside
straight
down.
ahead and do it. Can you tell what my fingers are doing even if you're looking straight ahead?
Yeah.
Good. What about over here if you're looking straight ahead?
Wiggling, wiggling.
Yeah. You see my fingers wiggling a lot, right?
Yeah.
Good job.
Even wiggling, wiggling.
That's exactly it. You know my thing, right?
Yeah.
All right. So by applying the weights, what we're doing is we're helping Jaden feel himself in space. So it helps him answer that question, where am I? The next part of that puzzle is, where is it? Whatever it is that he intends to pay attention to, particularly if it's something important like it's school, right? So that will help him determine where he's at so that he can better position himself, his body, and his eyes. We call that centering on what he needs to pay attention to. Once he's got where he's at, he's centered on the object he intends to pay attention to, the next piece to that puzzle is detail. In other words, he's going to focus in on it, right? And that is, what is it? That's the essential question, right? So then detail is derived from that. And that's where children who are visually dominant will then derive information visually from what they're looking at and form concepts about it, right? Like we were talking about earlier.
Right.
The mouth, the hands to eyes. So we're working on vision at this point, determining what is going on with that. And then the last part is what we refer to as communication, right? Or speech and auditory. Those are the other aspects of our systems that feed into what we refer to as the emergent sensory system, vision. So if you put those like in a Venn diagram, and I'll have one up for you guys, in the middle of that, where they all kind of converge together, is vision.
Okay.
So body, right, which is the where am I and where is it, and then vision, right, which is the eyes converging and focusing in on, is getting the detail of what is it, and then the cognition, right, the processing, making determinations about it so that they can talk to themselves or internally or externally about what it is that they see and learned.
Right.
Okay?
He's ready to practice.
Yeah, I can see that. All right, so what he's demonstrating right here is a real simple activity that we use to help integrate some of the primitive reflexes. This one specifically relates to Moro reflex, okay? So what we're going to do is let's set it up right here, buddy. Okay, now you got it? So if your toes are in, your thumbs are
Ow, I knew
very good. You got it. And then you just walk forward, right? Feet are nice and flat when you're walking, and then backwards. Excellent, Jaden.
Good job, buddy.
Okay, now if your toes are out, your thumbs will be, So if your toes are out, your thumbs are what?
In.
Very good, you got it. And then he's back.
Wow, you're getting so good at that.
I like that. Great effort.
And you said that's for the Moro, M-O...
M-O-R-O reflex, right?
Wow.
And there are also those that suggest that also addresses what we refer to as the asymmetrical tonic neck reflex as well, ATNR, right?
Okay.
So-
Google is going to be your best friend after this, guys.
So there's lots of primitive reflexes, but the ones we specifically address are Moro reflex, the asymmetrical tonic neck reflex, the symmetrical tonic neck reflex, spinal galant, and tonic labyrinth reflex.
So if a child had, what is it, torticollis? Please say that.
Torticollis.
Torticollis. Now, would that be an indicator that something could be needing adjustment in the future?
Torticollis is a medical diagnosis, right? So since I'm not a medical doctor, I don't really want to get into the details because
right.
I don't know that I could speak, intelligently about that well enough to inform the viewers.
Hey, Jaden.
But it does affect posture, and anything that affects posture will also affect vision. So a lot of the children that we see and work with, we look in their medical history,
Right.
and there is indications that torticollis has an effect on
Wow.
yeah.
That is so neat. Do you have any more exercises for him?
Okay, so we talked about this, and now there's a beanbag over there somewhere, right? Can we get a hold of
you
the
guys,
beanbag?
this is the coolest thing ever.
All right, so come on over here, buddy. Let me have the beanbag. Good toss. I want you to stand right there. Okay, right over there. Okay, so now what I'm going to do is I'm going to toss this to you, and I want you to catch it with both hands like this, okay?
Okay.
All right, you ready? All right, let's try it again. You did really good. All right, now let's try it again. Catch it with both hands.
Okay.
Good job. Let's try it one more time. Got it. All right, here we go. All right, now, come here. What I'm about to put on Jaden here, these are called yoked prisms. They're basically prism glasses. You can see there's a strong angle here. This is a 20-degree angle. And what these will do is change his perception of space because it distorts space a little bit. And in this case,
Wait a
quite a
minute.
bit so that it's really noticeable, right? Remember when you wear these, what happens?
that everything changes, even the earth.
Even the earth changes. I love that description. All right. Now, these are something that we use in vision therapy and in vision therapy only. These are not something that you can find out in the at Amazon, let's say, and be able to buy. These are used in vision therapy and prescribed by developmental optometrists. So again, this is just simply a demonstration of some of the things you might see in vision therapy. All right.
So, Chuck,
Yes.
do you want to come in for lunch?
Look at the
Maybe.
camera.
Let me find my beanbag. Okay.
Show
so
them
now-
what it looks like.
Now look at the camera. Okay.
The camera's down.
Yeah, he's looking right at you. Okay, so now when
Don't
you
move
look
him.
at the floor, what does the floor look like?
It's going down.
It's going down. Now come back. Does it feel that way?
Yeah.
Yeah, so go ahead and stand over there. We're going to play catch again. Now remember, I want you to catch it with both hands, okay?
Okay.
All right, you ready?
Can you move in a little bit? I'm
Good
sorry.
job.
Oh, Chuck, can you
Yeah.
move in?
This way?
No, Jane,
Towards it.
Jade, oh, okay. Jaden, move in.
Yeah, come on, buddy. Right there. Now, you ready?
Okay.
Now
Is that
catch it.
enough?
Okay, so we'll start again.
Okay, so just give it a minute and then.
Ready.
Okay.
All right, Jaden. So what I'm going to have you do is I'm going to have you catch it with both hands like this. Remember? Okay, you ready?
Mhm.
Good job. Let me do it again.
Wow.
Okay, catch it again. Oh, we missed one. Let's try it one more time.
Well, no, what should they be noticing? Oh,
Well, let's see if Jaden notices. Jaden, is it easier to catch?
Easy.
There we go. All right, so now, here we go. Nice and easy. Whoa, there we go. Come on over here. Let's go ahead and take them off. Great job. Now, I want you to look around the room and tell me how it feels.
Feels awesome.
Awesome.
can you come
All
back
right.
over here, please?
Be careful. Excellent. So let's do our 3 B's again, all right? You ready? All right. So our feet are flat. Breathing is calm. Good. We're looking straight ahead and we can see everything around us even though we're not directly looking at it, right? Oh, get your glasses on. Good job. Awesome. Very good. I appreciate your help on that. Yeah, that was great. Oh, what happened? Ah, okay. All right. So these are some of the general things that we might utilize in vision therapy to help a child establish that where am I
Right.
piece, because that generally, especially for at his age, is probably one of the most important pieces, is where am I in space. So you might have a child that is consistently seeking out sensory information. This is a child that's moving fast and bumping into things and grabbing things and has poor personal space and has a great need to be touched and,
Yes.
and touch things, right? So this is a child that loves to be hugged, and not just a light hug, not the the old bro hug, but the really big bear hugs that
Right.
kids sometimes enjoy. But you might have the opposite, which is also indicative of sensory issues and potentially a vision issue, is
Right.
where they don't seek it out. They
Okay.
want the opposite. So there's hyposensitive and hypersensitive, right? And so, but most of the kids we see, generally, particularly at Jaden's age, are the type that are sensory seeking, right? They need that feedback because they're not feeling very secure about where they're at in space.
That's crazy. I can't even fathom what that's like.
Yeah, what that would feel like.
Right.
Yeah.
No, yeah, exactly. I mean, that's just having never had that. I don't even know what that would be like.
Yeah.
All right, so tell everybody how we can find you guys, like, and also a little bit about the program that he's offering.
Okay. So again, I'll mention covd.org. So if you're not in the Northern Virginia area, you can look up a developmental optometrist at covd.org. Our website is virginiavisiontherapy.com, and you can find us on the web. It'll be probably the first engine, first item on the engine, Google search. So what we offer is basically vision therapy for children who are struggling in their education, who have vision-related issues. Like the most common is what we refer to as convergence insufficiency. That means the eyes basically just aren't teaming well in
Right.
near space and maybe even struggling in far space. We also deal with children who have eye turns. It's referred to as strabismus, but sometimes mischaracterized as lazy eye, right? Hey, buddy, you got stickers for everybody.
So Jaden has stickers for everyone. Okay, so
And then what is truly lazy eye is what is referred to as amblyopia.
Okay.
And that is where one eye doesn't clear as well as the other when trying to focus. And so we offer treatment for those types of vision issues, as well as we work with patients who may have suffered concussion or acquired brain injury.
oh wow.
Right? So
And this isn't just for children; it's also for adults.
absolutely.
Okay.
I have a patient right now who, I won't mention her name, but she's my age, and this is her first time in vision therapy. And she's adapted very well throughout her life
Wow.
with vision issues. And when I talk with her, she's got this long history that she describes. And she looks back on it and go, oh my gosh, yes, that was true. That was true about
That
me in
is
school.
crazy.
And but she recently started college again, and that's when the visual demand really increased for her.
Right.
And she recognized that whatever adaptations she had been utilizing up to that point weren't sufficient anymore. And so she's come in, and now she's really flourishing in her classes. She's really made a big change, and she's
Oh, wow.
just super positive about what's going on.
Wow. Guys, I really encourage you to research this, to get in touch with Dr. Davis in the area, Winchester, right here in this area. And then we can find you on Facebook, right?
Correct,
So
yeah.
it's, you tell me what it is, because it's not what I thought it would be. It's actually his name. It's Dr. Davis and Dr. Carlisle.
Yes.
Okay, so
Yeah.
go ahead.
Virginia Vision Therapy, yeah.
Okay.
But you won't find it as Virginia Vision Therapy, but look up Dr. Todd Davis and Dr. Amy Carlisle.
All right, everyone, and thank you so much for tuning in. You can follow me, as always, on Facebook or Instagram at Michelle Matthey. And to get notified every time When Life TV goes live, adjust your notifications. Take care and see you next time. Thank you. Yay! Now I have to take off my shoes.